All your life you have been deceived. They said that masturbation was filthy and that you ought to have outgrown it by the time you were 50. But nobody mentioned this. Masturbation isn't considered typical after the age of 60. It can mean the difference between survival and deterioration. I've been treating males like you for more than 30 years. I am Dr. Mohit Kara, a professor of men's health at Baylor College of Medicine and urologist. I've witnessed the unspoken effects of ignorance, guilt, and neglect. Too many decent men have suffered from things they were unaware of, not from illness, because this is the reality. The majority of older guys either quit masturbating altogether or do it incorrectly. They are unaware that the intentionality, frequency, and manner of self-touching can influence your heart, hormones, and even your brain. Indeed, a single careless act can lead to sadness, erectile dysfunction, and even issues with the prostate. When taken properly, it can maintain the health of your vascular system, increase testosterone, and enhance sleep. It's not only pleasure here. The goal is to protect function, restore connectivity, and combat aging at its root in the neural system. I'm going to reveal 7 masturbation secrets that any male over 60 ought to have learned decades ago. But first ask yourself, wouldn't you want to know what one aspect of your daily routine could do to improve your vitality, attitude, and health? Remain with me. The next 10 years of your life could be drastically altered by what you're about to learn. If you haven't already, please take a moment to click the notification bell and subscribe before we continue. In this manner, you won't miss another frank, scientifically supported health tip tailored to men in your age range. Simply put 1 in the comments section if you find resonance in this message. Type 0 if it doesn't. Your suggestions enable me to provide content that genuinely benefits you. Let's begin by discussing the first truth that most guys are unaware of until it has already caused them troubles. Because it may feel familiar, even innocuous, to masturbate in the same way you have for years or even decades. Routine, however, can subtly start to act against you after the age of 60. We start here. When it comes to self-gratification, older men make the most often ignored error. It's silent, unobtrusive, and might end up costing you more than you realize. First secret: ED and numbness can result from mindless masturbating. I wish more men would have the guts to discuss this with me. Hundreds of elderly people have visited my clinic over the years, their eyes down, their voices barely above a whisper, and their embarrassment. I would then inquire, do you masturbate? After a while, as the discussion became more candid, there was almost always a pause. Then the admission was made. Yes, but my feelings have diminished, or I have to do it a certain way in order to complete. Perhaps the one I remember the most. My body seems to have forgotten how to feel. They were unaware that their rapid, robotic, and disengaged masturbation had been conditioning their bodies to malfunction. What about the repercussions? Keep quiet, creeping, tragic. In addition to being a terrible habit, mindless masturbation is a neurological conditioning loop. Your brain is being taught to associate arousal with that particular routine each time you perform the act quickly, with tense shoulders, while scrolling through powerful photos with the same hand, motion, and result. Sadly, the brain picks things up quickly. What then occurs? Your sensitivity decreases with time. The quality of your erection begins to decline. You may discover that in order to feel the same as previously, you require additional stimulation, pressure, or tactics. Responding to a real relationship becomes more challenging. Because closeness feels too slow, too genuine, or too strange, you begin to avoid it. The actual harm begins at this point, emotionally as well as physically. I've witnessed men who believe their bodies are broken go into a downward cycle of frustration, shame, and even melancholy. However, their physique is frequently overtrained in the incorrect direction rather than damaged. Porn-induced erectile dysfunction, or PIED, is a disorder that can result from this conditioning. It can also cause delayed ejaculation or, in certain situations, full anorgasmia, which is the inability to climax at all. These conditions are not uncommon. Millions of guys are being silently impacted by them. The worst aspect is that the majority of them are unaware that they have inadvertently caused harm to themselves. The worst part, though, comes next. And I want you to listen to me. You lose more than just sex when you condition your body in this way and don't change your behavior. Your confidence wanes. You become disconnected. You start to back off. You become indifferent to your own body. You stay away from contact. You stay away from intimacy. And for a lot of men, that loneliness serves as a springboard to even darker areas, such as emotional detachment, melancholy, or even the earliest indications of cognitive deterioration. I have repeatedly witnessed it. The cost is not limited to the bedroom. You have it in your soul. It is evident in the manner in which you enter a room. It's in how you quit staring at your reflection. You start to fade away. I'm not here to embarrass you now. To wake you up, I'm here. The good news is that your body has the ability to relearn. The nervous system is capable of recovery. However, it requires self-awareness, perseverance, and a fresh perspective on pleasure, one that is more linked, slower, and more aware. Not only to feeling, but to feeling. The enemy isn't masturbation. However, it would be like putting your automobile in gear and pressing the gas without steering if you did it unconsciously. You crash eventually. Additionally, the repair process may take much longer than you anticipate by the time you realize the problem. However, the majority of men are unaware of this. While mindless masturbating is harmful, there is something even more subtle and widespread that is just as destructive lurking in plain sight. Furthermore, society actually applauds it. In the next secret, I'll reveal why it's possible that refraining from masturbating after the age of 60 is the thing that's slowly destroying your health from the inside out. Simply write the number 1 in the comments section to let me know that you're still with me if these insights are still relevant to you. Let's continue now. The next thing you need to hear is really crucial. Secret number 2. Masturbation lowers inflammation and congestion in the prostate. I can still clearly recall a man from a few years ago. David, let's call him. At the age of 68, he was a proud, quiet man who disliked discussing personal issues. However, he was waking up 5 or 6 times a night to go to the bathroom, so he came to see me. He claimed to have experienced fullness, pressure, and even a dull discomfort in the middle of his pelvis. He assumed that was simply the effects of aging. He was surprised when I inquired, "When was the last time you ejaculated?" He blinked at me as if I had asked him a ridiculous question. "Years," he said. "Since my wife died away, I haven't had sex. And to be honest, I believe that men of my age should no longer engage in sexual activity." The myth is right there, that the system should simply shut down when you reach a specific number, 60, 60, 70. However, I'll tell you immediately what I told David. Your prostate continues to function even after you stop ejaculating. It continues to produce fluid. Additionally, if that fluid isn't expelled, it accumulates inside your body, becoming a kind of stagnant reservoir. That accumulation, prostate congestion, inflammation, pain, and eventually serious health hazards are caused by this. Your prostate isn't made to hold on to liquids forever, and when it happens, it is itchy, bloated, and inflamed. Urinary urgency, weak stream, dribbling, and even pain during urination or ejaculation occur at that point. In actuality, it's a system that is supported and under pressure, but most men just attribute it to age. This is where things become serious. Prostate cancer risk has been associated with persistent inflammation in the prostate. Ejaculating frequently helps lower the inflammatory milieu that can make the prostate more susceptible to disease. But I'm not claiming that abstinence causes cancer. There's more. According to a big Harvard study that tracked almost 30,000 men over many years, individuals who ejaculated at least 21 times a month were much less likely to acquire prostate cancer than men who did not. It's not a myth. Data is what that is. Let me return it to David, though. He changed after we spoke, and he realized what was actually going on inside his body. He started caressing himself once more, not out of loneliness or want. His symptoms gradually got better. The strain subsided. He slept better. Before we get started, I'd love to know where you're joining me from today. Drop a comment below and feel free to ask any questions you have. And don't forget to hit subscribe button and turn on notifications so you never miss out on the best health tips. And if you're watching right now, I want to know you're with me. Type 1 in the comments if this video speaks to you. Type 0 if not. More than that, a light returned to his eyes. A piece of himself that he believed had been laid to rest was reunited to him. Ignoring this will cost you more than a few restless nights. It's persistent discomfort. It's medicine that you may not require. In the future, there will be surgery. Indeed, there may be a greater chance of developing cancer, all due to the notion that a man of your age shouldn't be claiming this aspect of his health any longer. You wouldn't disregard your emotions. Your blood pressure would not be disregarded. Pay attention to your prostate. What if I told you that men's emotional shame about touching themselves, which includes years of guilt, secrecy, and discomfort, actually exacerbates the physical symptoms? Because the following secret reveals just that. You can also have a completely different perspective on your body after you realize the link between physical deterioration and emotional suppression. Secret number 3. Shame about touching yourself harms your mental health. Many older guys have a particular quiet. In my workplace, I constantly see it. It manifests itself in their actions rather than their words. When I inquire about their sexual practices, their eyes change. The way their shoulders drop when someone mentions masturbation. The way they dismiss it with a joke, shift the topic, or tell me, "Doc, that's something I don't do anymore. It was for my younger days." But the subtext is audible to me. They didn't quit because they desired to. It's because they were educated along the road that continuing was bad. And I'll tell you the truth. One of the biggest threats to your health today is this type of shame, which is silent and unacknowledged. Many of you were brought up during decades when touching oneself was viewed as immoral, filthy, and weak. You were made to feel ashamed, chastised, or punished. What about those early messages? They did not vanish. They simply went underground. They subtly shaped your relationship with your body while sitting deep within your bones and neural system. Even now, a silent retreat is the outcome. Even when you want for physical contact, you start to detach from it. You start to think of desire as improper. Not because you don't want to, but because you've been taught that you shouldn't. You stop aiming for yourself. And that distance becomes more than just an emotional one over time. It turns into a biological process. Because most men are unaware of this. In tangible, quantifiable ways, regular, healthy sexual contact, including masturbation, supports mental health. It controls cortisol. It increases dopamine. It promotes oxytocin, the hormone that builds connections and trust in your brain. It even improves mood, cognitive function, and sleep. Shame, however, ruins all of that. Shame causes your muscles to tense, your stress hormones to rise, and your mind to form guilt loops that you are no longer even aware of. Shame is a source of stress. And long-term stress, it has been connected to immune system dysfunction, heart disease, anxiety, depression, and possibly dementia. I had treated a 72-year-old patient who had just gotten divorced and was quite miserable. He had no serious medical conditions or prescription drugs, but he felt lonely, numb, and fatigued. He informed me that it had been more than 10 years since he had engaged in any sexual activity, either alone or with another person. He remarked, "I just assumed that chapter was closed," and there was a silent sorrow beneath his words. For the sake of losing oneself, not for the sake of losing sex. We worked together gradually, without the use of drugs or major changes, just basic activities to help him regain his connection to his own body, free from expectations and guilt. A few weeks later, something changed. He began to walk with more height. His sleep has improved. He chuckled once more. His blood pressure decreased. He wasn't fixed. They reunited him. Shame demands that payment from you. One gradual inch at a time, it drains your vitality. It deceives you into believing that you are too old to experience life. However, you're not. It's never too late to treat oneself with respect, decency, and intention. It's never too late to feel complete. What do you believe happens when hormonal decline adds fuel to the fire, given the damaging effects of shame? Because most men don't see the next truth coming. You don't simply lose testosterone as you get older. When you completely stop interacting with your sexual self, it diminishes more quickly. And it impacts far more than just your sex drive once that hormonal balance starts to shift. What we're going to discover next is that it alters your thoughts, movements, and way of life. To let me know if you're still with me and interested in this, please put the number 1 in the comments section. Let's go on to the fourth realization. You might be surprised by this. Secret number 4. Even solitary sexual action stimulates testosterone. I want to share with you something that most men don't know until it's too late. I hope all males over 60 could hear this clearly, without hesitation or shame. As you age, testosterone, the hormone that gives you power, vitality, drive, confidence, and sexual desire, does not simply gradually diminish. You've been led to believe that. However, after working with men exactly like you for decades, I've discovered the truth. When you cease living like a man who still wants to feel alive, testosterone levels likewise decline. Your body starts to reduce its own masculinity when sexual energy is disregarded, repressed, or buried behind years of guilt and inaction. He no longer needs this, it states. Additionally, it begins to reallocate resources, reroute hormones, reduce blood flow, and conserve energy. You lose the edge that used to make you feel like yourself, your tummy gets bigger, your sleep gets worse, and your muscle tone dwindles. Your body no longer receives reminders that you are still alive, present, and capable of desire. Not because you are elderly. I recall a man by the name of Frank, 7th fireman by retirement. It used to be all presence and might. He told me he hadn't felt like himself in years when he first came to me, drooping and exhausted. He said, "I'm just slowing down." However, I examined his labs. His testosterone level was just above the clinical threshold. He simply shook his head when I questioned him about having sex. I no longer see the purpose. The true danger lies in that belief alone. Not the date on the calendar, but the instant you no longer consider your sexuality to be an integral aspect of who you are. I gradually assisted Frank in getting back in touch with himself, not with anyone else. Basic procedures, no embarrassment, simply being there. His posture also changed over the course of the following few months, along with his hormone levels. He spoke with greater authority. He resumed lifting. When he spoke, his eyes glowed. The body reacts to what you focus on, you see. Your testosterone pays attention when you disregard your sexual self. However, you are communicating to your brain that you still require this when you revive it, even if it is by deliberate, solitary touch. Still, I want to feel. In response, the brain reactivates systems that have been inactive for years. This goes beyond theory. Studies have shown that sexual stimulation, especially when done alone, can result in short-term increases in testosterone. We've seen how hormone regulation, motivation, and mood may be impacted by erotic imagining, physical contact, and even anticipation. Your body is designed to react to presence, connection, and pleasure. Additionally, it gradually begins to return nothing when you give it nothing. The price? Most males are unaware of how high it is. Not only has low testosterone been linked to sexual dysfunction and exhaustion, but it has also been linked to heart disease, diabetes, depression, cognitive decline, and even a shortened lifespan. It's more than simply a figure. It's a crucial indicator of your level of involvement with life. What's the worst? Until it seems nearly impossible to return, most men are unaware of how far they have strayed from who they are. However, there is a path back, and it starts with regaining your own relationship with your body, on your terms, in your space, and guilt-free, not with medicine or surgery. Reminding your biology that you're still in the game is the goal here. Just wait until you hear what I have to say next, if that surprises you. Because testosterone isn't the only important factor. And every time a man touches himself improperly, he is subtly harming it. The fifth secret. Erectile dysfunction is a mechanism that must be used or lost. After the age of 60, many men start to believe a quiet lie. This is how it sounds. I don't have to worry about erections if I'm not having sex. It's something I've heard a lot. Men dismiss worries about their role because they believe they are too old to require it. I'll tell you something, though. Most doctors don't express things clearly enough. Sex is only one aspect of erectile function. Other factors include blood flow, nerve health, cardiovascular integrity, and lifespan. Harold was a 69-year-old patient of mine once. Strong background, intelligent man. but he hadn't had an erection in 5 or 6 years. He believed there was no need to, not because he couldn't. Since he wasn't dating and his wife had died away, he assumed that phase of life was ended. He was unaware that his body wasn't only sitting there waiting for him to return to it. It was putting an end to things. The majority of men don't comprehend this. Like every other muscle and vascular structure in the body, the penis is similar. The tissues lose their suppleness, blood vessels stiffen, oxygen flow drops, microtears and fibrosis, and soft tissue hardening begin to occur if you don't use it. Eventually, even if you want to use it again, it won't respond the same way it used to. Not because you're getting older, but because you're not using it. This is where the price, which is high, comes into play. The smooth muscle in the penis starts to atrophy when regular erections cease. Engorgement is caused by a delicate network of blood vessels that loses some of their efficiency. Nitric oxide, an essential molecule that initiates erections, decreases. This is the part that nobody tells you. Whether you're attempting to engage in sexual activity, this occurs. It's biological. Your body believes the system is out of date if you don't regularly experience arousal and engorgement. Over time, the harm becomes psychological as well as physical, since the mind starts to follow the body's declining capabilities. Confidence erodes. Self-esteem falters. Your body is no longer reacting to the identity you once held, which is why you feel less like yourself. Not because you're getting older. This causes melancholy, withdrawal, and even the earliest indications of cognitive decline in many males. I have seen it occur slowly, subtly, and entirely avoidable, rather than all at once. What are you able to do then? You can remind your body that this system is still necessary and that it still matters. You don't need a partner, pressure, or shame to accomplish that. Regular erections maintain blood flow, oxygenation of tissues, and the health of neural pathways, whether they are achieved through self-stimulation or even non-sexual arousal. Pursuing pleasure for its own sake is not the point here. It's about protecting an essential aspect of your identity and physical well-being. Maintaining erectile function involves more than just having sex. It tells your body that you are still alive, involved, and connected. And don't misunderstand me. I know how easy it is to become silent, particularly when society tells you that you should stop talking after a certain age. But there's a price for silence. Additionally, your body retains the score. If erections are that important, you may be asking yourself, what else might be preventing you from getting and maintaining them naturally? And that leads to something that is even more harmful than inaction. Until their brains are rewired, most older men are unaware of the modern addiction. In the following section, we will discuss how pornography, yes, even harmless pornography, can steal your joy, sensitivity, and arousal in a covert manner. Secret number 6. Porn alters your brain, but you can take charge. I want to discuss something that's frequently overlooked, particularly for older men. Pornographic images. I am aware that the mere mention of the word may cause some of you to shift in your chair or even turn your head away. However, if you're still with me, I'm asking you to listen to this with an open mind and heart, because what I'm about to say has the potential to alter your perception of your masculinity, body, and thoughts. Men in their 60s and 70s have sat across from me and acknowledged that they continue to watch porn. It's one of the few ways they still feel something, not because they're obsessed. A large number of them are single. Some people have divorces, some people are widowed. They're not looking for excitement. Their goal is to make a connection, or the recollection of it anyway. However, nearly none of them are aware of this. When they were first exposed to pornography in their 20s, it was very different from what is available today. Static images and gentle visual cues have given way to a deluge of fast-paced, high-stimulation, instant gratification content. Furthermore, the human brain, especially an aging one, isn't designed to handle that level of overload without experiencing negative effects. Dopamine, a neurotransmitter linked to motivation, reward, and pleasure, is released into your brain each time you watch porn, particularly the more extreme or fast-paced types. However, your brain's reaction to natural stimuli becomes less sensitive with repeated exposure. Simple, in-person touch becomes less effective at arousing feelings. To feel anything at all, you start to require more intensity and novelty. Taste isn't the only factor. The topic is neurochemistry. It's about repetition changing your wiring. Additionally, your body follows your brain's conditioning to anticipate exaggerated artificial stimulation. Less responsive erections occur. It gets harder to have an orgasm. Some men even experience severe erectile dysfunction brought on by porn, which means they can only perform with porn and not at all with a real partner or when they are by themselves. This has far-reaching consequences outside of the bedroom. I've witnessed men descend into feelings of guilt, worry, and annoyance. They begin to think they're damaged. They retreat. They have a sense of defeat. Sadly, they never make the connection. They are unaware that the very thing they were using to find solace was gradually draining them of their energy. However, I want every man who is listening to comprehend this. This cannot be undone. You're not damaged. You can be retrained. Even at 60, your brain can still repair itself, reset itself, and rediscover the sensation of grounded, authentic arousal. However, the healing process starts when you let go of synthetic euphoria and give your body permission to reestablish a connection with reality, presence, sensation, imagination, and yes, even silence. Some men decide to abstain from all visual stimulation for 30 days. Others take their time getting used to it. It's important that you start reestablishing the connection between pleasure and your nervous system on your own terms. It's not about sacrificing pleasure. To recover it, to reclaim it as your own, to have a genuine feeling. Now, the next secret could hit you even more hard if porn has made you less sensitive, because loneliness can take over your spirit, just as digital content can take over your brain. The last truth I'll tell you may be the most significant of all. It has nothing to do with chemistry or technique, but rather with what happens to a man's body when he is completely cut off from touch. Secret number 7. Isolation is the most dangerous mistake. Out of all the dangers older men encounter, there is one that is more harmful than porn, more dangerous than dwindling testosterone, and more harmful than any physical symptom. Isolation is that. Not the type that implies living alone. I refer to a more profound form of quiet, the kind that stops touching you. Don't touch yourself. Give up relating to your body. Not voluntarily, but because you were taught at some point that men your age should leave that phase of life behind. A man named Peter comes to mind. His age was 76. An engineer in retirement, courteous, assemble. However, his voice sounded hollow when discussing his daily activities. He informed me that it had been more than a year since he had been physically touched. Not a hug, not even a shoulder shake. Nothing. He didn't say it dejectedly. With resignation, he said it, as if it were just the end of a chapter. Touch is not a luxury, which Peter was unaware of. The need is biological. Even at 60, 70, or 80 years old, the human body is programmed to do this. Our nervous system starts to downshift when we are separated from others for an extended period of time. Oxytocin decreases. Stress hormones start to show up. Blood pressure increases. Sleep is negatively impacted. Immune system function declines. Most dangerously, the brain starts to protect itself by shutting down sensory and emotional circuits. That is, we become numb when we are no longer touched, emotionally as well as physically. We no longer feel alive. We lose the sense of urgency to interact with the outside world. The sad thing is that this occurs gradually, silently. You're just skipping your routine one day. You're avoiding mirrors a week later. After a month, you no longer find any pleasure in your imagination. This is the part that nobody discusses. The bedroom is frequently where isolation begins. A man's brain interprets stopping touching himself, not just for pleasure, but also for presence and self-connection, as an emotional retreat. That withdrawal eventually starts to reinforce itself. He becomes convinced that there is nothing left to feel, touches himself less, and feels less. The true cost is that. Not merely diminished desire or lost erections, it's the gradual loss of purpose, identity, and emotional acuity. It's connection's silent demise. Additionally, loneliness has been directly connected to heart disease, depression, and even early mortality because of abandonment. not because of age. By oneself, not by others. I want to be clear now. Shaming someone is not the goal here. Life occurs, loss occurs, distance occurs. Surrender, however, is not necessary, because touching oneself, whether or not it is sexual, is not a habit or a sign of vanity. It's about telling your brain, heart, and nervous system that you're still here and asserting that your body is still yours. I'm still important. Still, I want to feel. Just by allowing themselves to reconnect, to rekindle the connection, to touch again, to awaken the parts that went silent too quickly. I have witnessed men come back to life. And when they do, their voice comes back, their posture shifts, and their spark starts to ignite once more. And the most crucial aspect of all might be what comes next if you're still with me now, and something in this resonates with you. Now that you've heard the 7 truths no one ever told you, I'll walk you through the process of starting over step by step, using a straightforward yet effective technique I use with my own patients. Rewiring your body, restoring sensitivity, and restoring what time and silence attempted to take away are all accomplished by this daily ritual. In conclusion, if you have read this far, I would like to take a moment to talk to you not only as a doctor, but also as a man who has sat across from other men for decades, listening to their regrets, fears, and occasionally their silent hopes. We have discussed more than just masturbation today. It has to do with something far more profound. Your relationship with your body, your history, and your willingness to accept that your life, your sexual life, your emotional life, and your physical life isn't over because society says it should be are all important factors to consider. The fact that mindless masturbation can gradually teach your body to malfunction was where we began. That it's not harmless to rush through the motions while disengaged and preoccupied. Your sensitivity is being undermined and your brain is being rewired. We examined how completely avoiding ejaculation can result in inflammation, prostate congestion, and in certain situations, an increased risk of cancer, that your body's systems suffer when it stops moving because it was made to do so. We discussed shame's silent poison, how a lot of men continue to harbor guilt that isn't even their own, guilt that they inherited from their family, culture, or religion. A healthy man's relationship with his own body cannot tolerate guilt. We discussed how low testosterone is accelerated when you stop interacting with your sexual self and isn't just a result of aging. How even something as basic as a solo touch can begin to change that. We discussed how an erection is a sign of vascular health as well as a sexual function. It really is a use it or lose it situation. That ignoring it will cost you more than just your self-esteem, drive, or even memory. Then not to embarrass you, but to explain how porn changes the chemistry of your brain, we open the door. That biology is the issue, not morality. That what initially excited you can eventually make you numb to reality. Lastly, we examined the most hazardous error of all. Separation. The body starts to withdraw when you stop touching, being touched, or interacting in any way. Not only from enjoyment, but also from meaning, feeling, and life itself. What I want you to take away from all this is simple. You're not damaged, you haven't missed the point, and you're not alone. Every system in your body, even now, wants to respond to connection. Your brain still wants to feel. You still want to let your heart open. Your skin still wants to remember what it means to be alive. And that journey back doesn't require anyone else. It starts with you. It starts with a choice. To stop shrinking. To quit feeling guilty about wanting to feel good about your body. To reject the myth that getting older renders one invisible. You're not invisible. You're still here. And what you do with that matters. So here's what I tell my patients when they're ready to start again. Not with pills, not with guilt, but with presence. I give them a simple daily practice, what I call the golden protocol. 10 minutes a day. Quiet, intentional, respectful time to reconnect with themselves. No agenda, no pressure. Just touch, breath, and awareness. For some, it becomes a morning ritual. For others, a bedtime routine. But almost always it becomes a turning point. Because when a man touches himself with care, not out of habit or desperation, but with curiosity, something shifts. His body remembers. His mind softens. His spark returns. And maybe yours can too. This isn't just about reclaiming your sexuality. It's about reclaiming yourself. And that starts right here, right now, with you.